Working day, and the next topic is again about polio, and I give the floor to Igor Pereginets, who is Deputy Minister of Health of Ukraine, Dorit Nitzan, who is a representative of World Health Organization, and Dragoslav Popovic, who is UNICEF representative, and Giovanna Barbaris, who is head of the UNICEF representation in Ukraine, and Shahiv Youssef, who is an expert in vaccination of the European Bureau of the WHO, and we will talk about the action plan on the control of the polio situation in Ukraine. So Igor Pereginets will start. Hello, colleagues. Thank you for your attention and thank you for giving me an opportunity to meet you today. I am grateful to our partners and colleagues from WHO and UNICEF. We would like that they joined our today's event. We would like to report on the situation about the control on polio in Ukraine and answer your questions and share our preliminary plans about reaction. As you know, in Transcarpathian region there was an outbreak of polio caused by the circulating polio-related virus 1, and it is about a kid of 4 years and a kid who is 1 year old. They live in different cities, but the data confirms the active circulation of poliovirus, which is related to a vaccine at least over the entire territory of Ukraine. The situation has emerged as a result of a protracted and sufficient level of vaccination in Ukraine. However, the system of monitoring has reacted. We have detected the problem, and now, according to recommendation of WHO and UNICEF, we treat this situation as an outbreak of polio. We have to react to it according to the international legislation, and the health ministry started to draw a plan of action to immediately react and to prevent the virus from spreading. There will be vaccination of children, but first of all, yesterday on the 3rd of September, the ministry saw the sitting of the coordinating working group on the issue of supporting the status of Ukraine as a polio-free country, which was created recently by a decree of the Ministry of Health. Also, colleagues from WHO and UNICEF took part, and the first measure in the action plan should be forming a headquarters to react to the situation, composed of experts of the public health and UNICEF and WHO and other ministers. We also apply for help in getting the second batch of humanitarian aid polio vaccine. We received the first batch in the beginning of May. We are reinforcing measures, monitoring measures in the regions through sanitary epidemiological stations, and in the nearest future, the vaccine that was received from UNICEF with the help support of Canadian government will be sent out to regions. We're also working on recommendations for the national level, regional level, and recommendations for patients, families, and parents. So the situation now is in the stage of active planning. It is absolutely under control at the level of the Ministry of Health. And we did plan the preventive vaccination campaign even before, and there were 3 trainings for regional experts in polio vaccination. There was also an advocacy campaigns. So at the moment we have some things that will help us, done by our international partners, and I am ready to answer any additional. I will ask my partners to answer questions after they make short introductions.
Одне питання. Всі кажуть про
Mr. Pereginets, everybody says that the massive vaccination campaign should be started immediately after this outbreak, and nevertheless, there are not enough doses of vaccines in the clinics and hospitals. And when the campaign will be started, and whom you will vaccinate? Those children who had received 3 vaccinations already, or you will make additional vaccination, or you will organize it in different way. This requires professional answer. You are right. We do not have, as of the moment, sufficient amount of doses for vaccination, but in Zakarpattia we have at least 20,000 doses which are necessary there, and we have additionally more doses of oral vaccines, and within 2 weeks maximum the doses will be supplied to the regions of Ukraine, and we will start the campaign.
Question: who is going to be vaccinated? We have to differentiate between routine immunization activities and outbreak response. This is outbreak response, and the purpose of the outbreak response immunization is to stop transmission. And for that purpose, everybody, we're selecting an age cohort. It could be for this, we are recommending from 0 to 6 years old, vaccinated, everyone, all children, without a reference to status of vaccination. Even if they have 3 or 4 doses of polio vaccine previously, all children in these particular age cohorts should be vaccinated, because the main purpose is to stop transmission.
Наступне питання.
The question. We had the question from NTN.
Доброго дня.
Hello, NTN TV channel. Could you tell us, please, in more detail about some statistical information, how dangerous this infection is? And maybe you can remember such outbreaks of infection, and they are already talking about the 3rd case in Mukachevo. Yeah, I will ask our experts to talk about this, because it does need a very detailed expert assessment of the situation. You're asking about statistics in Ukraine or in the world? As far as I have learned, the last outbreaks were in Africa, and, well, in the world, yes, statistics for the world.
About the vaccine-derived poliovirus itself, it's a... Yes, I don't need it. Yeah. So it's very rare case. This particular kind of vaccine-derived, circulating vaccine-derived poliovirus, it's very rare. In last 15 years, I'm talking since 2000 until 2015, only 26 outbreaks were registered throughout the world. And total number of circulating vaccine-derived poliovirus cases were 756. The latest one of this was in Madagascar, and currently we have 2 cases. The Madagascar outbreak is still continues, and the most recent one is in Ukraine, where we have 2 confirmed cases with the possibility of having more.
Maybe just to mention.
Yeah, and if I may make a comment about terminology. I was following English translation and Russian translation, and there is a problem with terminology. In English it was said associated, in Russian it was вакциноподобный virus. It's not вакциноподобный virus, it's different. It's in Russian it's said вакцина родственная. Это дериват, это мутант. And in English it's vaccine-derived poliovirus, which is completely different because that is the problem what we have. People, we are monitoring the social networks, monitoring public questions. People are relaxed because they think this is vaccine-associated poliovirus, which is a normal, normal case during the immunization. And we have one case of vaccine-associated poliovirus per 2 million. This is the situation what we have in Ukraine. It's very dangerous. It's very rare, but it behaves as a wild poliovirus. That's why I'm requesting journalists, ladies and gentlemen, please use correct terminology.
Українською це звучить вакциноспоріднений, і це важливо.
Ukrainian, this is vaccine-related, not associated, but related to vaccine, which is a very great difference. It is a mutated virus which behaves as a wild poliovirus and can cause poliomyelitis, and this is the danger of the situation, and that's why the international experts underline that this is an outbreak of polio.
More points just to the epidemiology. What we see now, and it's important for us to emphasize, is what we see now is the tip of the iceberg. Those two patients have behind them many, many children that carry the virus actively now. And this is why people that think, oh, we only have two children in Zakarpattia, then these people should be alerted that this is not the case. And I'll explain for short why. In 200 children that get the virus, only 1 to 2 will develop this type of paralysis, which is the one that we're talking about. The rest will either have mild disease or will not be sick, but they continue circulating this virus in their stools, in the system, and it goes for the other children around them. So this is going to go in waves, and it has no knowledge of oblasts, borders, line, whatsoever. The virus is here, and if you go through mathematical model that every child already has 198 behind them, then 198, each one has many, many children around them, and each one, you get to thousands of children that are already at risk in Ukraine right now.
Маємо ще 3 запитання. Прошу.
Ксенія Дворнікова, 5 канал, запитання.
Ksenija Dvornikova, my question to the Deputy Minister. How many doses of vaccines do we have at stock, and what is the need? So, what is the shortage in vaccines doses, and why children were not vaccinated? Whether there were no enough vaccine doses, or what was the reason? Now at stock we. In general, we have to receive 3,700,000 doses, and this 7,500 oral doses, inactivated vaccine doses. Now we have several hundred of doses of oral and 100 of inactivated vaccines. We expect to receive more, up to 1 million doses. Why those doses were not prepared in enough quantity? Because we planned a routine vaccination campaign we had been preparing this campaign from spring, and we're working in our routine level, but unfortunately the outbreak happened, and now the tactics for this vaccination campaign is changed. Instead of routine campaign, instead of general prevention campaign, we will have the alert campaign, and now we are ready to supply the regions with additional doses of vaccination supplied by WHO and UNICEF. We are definitely sure that we will receive this as a humanitarian aid from our international partners. Could you please explain more about this vaccination campaign? In a week, we will have these vaccines in the regions. People have to apply to the clinics, to the epidemiological services. What should parents do in this situation? As I mentioned, we are working on this issue very intensively. We have started our work on Sunday, and we have been developing recommendations. We will provide parents with clear recommendations what to do. We will have action plan and communicate it to the regions. In line with the action plan, the regional authorities will act. As for the age of children, we mentioned that all children between 0 and 6 years of age will be vaccinated during this campaign, irrespectively whether they were immunized or not in the past.
Just to add a little remark. It was mentioned the importance of using the right terminology in defining the type of disease that we are confronted with. And it is also likewise extremely important to ensure that parents and families do receive, the right information about the risks of polio, because in Ukraine right now only 27% of mothers do know that polio can actually result in paralysis. So it is of crucial importance that the mass campaign, the activities, the vaccination activities that we are going to be supporting are also very much accompanied by the right communication to families and to doctors as well. Thank you.
Радіо Свобода, питання до пана заступника міністра.
The question to Deputy Minister. Well, in fact, we have already heard this question, why there was a decrease in vaccination, but we're not talking about last year, but in what Olga Bogomolets said, for instance, in 2009 and 2013, yes, you're right, the situation started to deteriorate from 2008 after a rather high level of anti-vaccination campaign connected to immunization and a rather low level of awareness in the population of the importance of immunization. According to WHO, immunization is one of the major inventions of humankind where the protection of population is concerned. And because of immunization, a number of deadly diseases are averted or even liquidated in the work. So to raise the issue of immunization as an instrument, we should always, of course, question it, but there's a lot of proof that it does prevent deadly diseases. Regrettably, in Ukraine, because of a short-sighted policy of previous years, and because of the economic crisis, we didn't have enough money to provide for the sufficient quantity of vaccination, and also not enough public awareness. And this all resulted in not enough vaccines and low level of trust in this. So Ukraine has one of the lowest levels of vaccination in the world. And we did plan to correct the situation this year, and this was the purpose of humanitarian aid in May, to avert the outbreak. However, we were not able to manage this in time, and the WHO has warned us for the last 2.5 years that this was going to happen. Could you please tell us whether there's a threat for adults? Can they get the virus from the children, or is it only children who are affected, and how the virus is transferred?
There's a risk of transmission. It's transmitted by oral fecal way. In case of poor sanitation, everybody who is not vaccinated is under risk of getting sick. And as a result, I mean, as an example, during the latest outbreak of polio, which we had in our region 5 years ago in Central Asia, we had more than 450 cases, of whom about half were adults. And out of 27 persons who died, again, about half were adults. This is just for information. There is a risk, and risk is huge.
Ще одне питання від 5-го каналу.
Another question from Channel 5. Because of this new information that adults can also become sick, this vaccination that people can do, will it spread to adults as well, or will it concern only children? Is it going to be free? Is it going to be for everybody who wants, or maybe there will be some coercion to do this? Well, from the Public Health Ministry, I can tell you that, of course, this is going to be free, and there cannot be coercion in this respect, but we will apply maximum effort to inform people so that they take informed decisions, and will apply maximum effort to provide the maximum expert information that will help to adopt a decision to, first of all, protect children, not forgetting about adults, of course. As I told you, we have absolute understanding from our international partners as far as the delivery of additional batches of vaccines is concerned. We know the minimum requirement, and we will try to cover the maximum requirement. And if the adults want, they can get vaccine as well.
The point that we are in this situation with the outbreak, particularly as the coverage rate against immunization over the past 8 years was very low in Ukraine. We focus on the children born in this period, and they would be absolutely priority. On the other hand, and when we're talking about the adult population, we have to say that there is a history of using oral polio vaccine in this country for 60 years. And the coverage rates in the past and the protection of people in the past were much higher than today. So most of the adults would be safe in this situation. But of course, we don't want to downplay the risk for those who are not immunized.
Колеги, чи є ще запитання? Пане Ігор, до вас тоді, мабуть.
Further question, maybe Igor, this will be the last question to you. How do those children feel now? The child of 4 years old is much better, absolutely rehabilitated totally. The 10 months child is under rehabilitation period now. Thank you for this information. This was our last briefing for today. Thank you very much. Tomorrow